Welcome to the Invite Health Podcast. I am Dr. Amanda Williams, MD, MPH, and on today's episode, I am going to be discussing digestive health. I did an episode previously talking about the importance of digestive enzymes, especially in the setting of the aging process, because as we get older, our body becomes less efficient in making those enzymes to aid in the breakdown of foods. But I also wanted to talk about another really important factor that comes up when we talk about the GI tract, when we talk about digestion, and for so many people out there who suffer from GI-related issues such as heartburn, when you look at GERD, which is gastroesophageal reflux disease, and we have to consider, are there nutritional links to this? And this is why I wanted to do an episode today that's going to focus in on key nutrients, at the same time really hone in on the main underlying reason as to why so many, not only in the United States, but globally, deal with upper GI issues. So when we're talking about the stomach specifically. So I'm going to go into some details. We're going to get into heavy science on H. pylori, which is Helicobacter pylori infection, and talk about why it's so important that if you happen to have a history of heartburn, having excessive belching or bloating, that you need to make sure that you rule out H. pylori, because this can be a very damaging and deadly bacterial infection that happens to reside within the lining of the stomach. So I'm going to talk about all of that before I get too much further into the details on digestive health and talk about the different nutrients and talk about the details of H. pylori. I just want to give you a reminder to subscribe to the Invite Health Podcast. Remember, you can leave us a review. You can also follow us on Facebook, Twitter, and Instagram at Invite Health. Remember that all of the information on today's episode will be linked in the episode description, and you can visit invitehealth.com/podcast for more information. So I want to talk about all of the many different factors. I want to talk about GERD. I want to talk about H. pylori infection. I want to talk about zinc deficiencies, which we know are incredibly common throughout the world, and then tie that obviously into U.S. statistics. So when we look at something such as gastroesophageal reflux disease, which is GERD, it's roughly somewhere about 40% of the U.S. population have GERD. So that's a pretty pronounced amount. Now we can look at our food and we can say, okay, well, people follow a standard American diet, which doesn't necessarily lead to the healthiest means by which our GI tract will be satisfied, which is why I always encourage people to adhere to the Mediterranean diet. Much easier for all of those very critical digestive enzymes that I talked about in the previous digestive health podcast, for those enzymes to work efficiently. When we're throwing in these processed foods and these chemical-laden foods, those enzymes just have no idea what in the world they are supposed to do. They don't recognize, okay, is that a carbohydrate? Is that a protein? What in the world is it? Because it's just laden with all these different chemicals. So foods always matter. Now, the other thing to keep in mind is when we look at nutritional deficiencies, and we can include within that zinc, and we can look at zinc deficiencies, understanding that throughout the world, zinc deficiencies are quite common. Now, in the United States, it's probably somewhere around 15% of the general population has zinc deficiency. But this actually changes when we get into different age groups, when we get into different races. So when we think about the elderly and the aging U.S. population, we then recognize that zinc deficiencies are going to go up. And this really comes down to either an inadequate dietary intake or less absorption of zinc within the system. Now, why does this all matter? Well, we know that zinc plays such a critical role in so many aspects of our overall health. When we look at our immune system, for example, we must have zinc in order for proper immune function of both the innate as well as the adaptive. So that's your immediate and your delayed immune system response. We have to have zinc when it comes to proper wound healing. So anyone who's going in to have any type of a procedure, I always encourage them, make sure you take vitamin C and zinc, both pre-op as well as post-op, because we require zinc in order to be able to heal. Most people recognize zinc when we talk about the common cold, but we also have to think about zinc's role when we look at eye health, for example. We know that age-related macular degeneration has been linked with low levels of zinc. So we have to have zinc coming from dietary sources. Now, here's where the problem comes in. When we think about the dietary exposure coming from our foods, if people are following a standard American diet, we know that the majority of Americans are doing that. I always defer back to the study out of the University of North Carolina that only 12% of Americans are quote unquote metabolically healthy, meaning you're getting the adequate nutrients from the foods that you are taking in every day. So we look at all of the different food sources of zinc, and this is where the problem comes in. Most Americans are not obtaining these foods. So when we look at things like seeds and nuts, most Americans are not taking in things like pumpkin seeds or cashews on a regular basis, or almonds. So our exposure to zinc coming from food is generally very, very low. And this is hence the problem why it's also a global issue. And the global zinc deficiency certainly is problematic. When we look at different areas throughout the world, we can basically hone in, and this is what's quite interesting, is when you hone in on these areas and you say, okay, zinc deficiency is very prevalent. And then we look at the GI issues. There's a strong correlation. That's why I wanted to tie these two things together. Because when we look at H. pylori infections and Helicobacter pylori, this awful little bacteria that is really common and can do so much damage to the stomach, which is the number one cause for peptic ulcers and duodenal ulcers, as well as the number one reason for gastric cancer. So we have to pay attention to this bacteria. We can't ignore it because it can do such damage. Now we look at areas in the world where the occurrence of H. pylori infection is really high. Now, interestingly enough, those same areas where H. pylori infection is very high, we also see a trend in high levels of zinc deficiencies. So this is why I think it's really quite critical that we understand that correlation and that we are able to connect those dots. So I'm going to take a break. When we get back, I'm going to talk about more of the statistics when it comes to zinc deficiencies, when it comes to H. pylori infections, as well as what we can be doing to make sure that our diets are including the right foods and we are supplementing with the right nutrients to enhance our GI system. We will be right back.
This podcast is brought to you by InviteHealth.com. For over 20 years, Invite Health has provided premium quality supplements and expert advice you can trust. Now, first-time customers can enjoy an exclusive offer. Visit invitehealth.com/podcast or click the link in this episode description. That's invitehealth.com/podcast for your exclusive offer on Invite Health products. Invite Health offers the resources you need to make important decisions about your health. Chat live with degreed healthcare professionals, get product information, and find retail locations near you at invitehealth.com. You can also learn about our new genetic testing program and our exclusive Invite Fitness Wellness program. Follow Invite Health on Facebook, Twitter, and Instagram, and be sure to subscribe to our podcast today. Now back to our episode.
And welcome back. So I was talking about inadequate zinc intake and looking at zinc deficiencies, understanding the role of zinc in the human body and how zinc is needed for so many different functions that the average diet is not giving enough zinc when it comes to total milligrams per day. Now, we can look at things like the RDA. We know RDAs are not always accurate, and that's the recommended dietary allowance. Oftentimes, those are really underestimated. Vitamin D is a perfect example of that. But when we look at zinc, the RDA for zinc is roughly about 10 milligrams for an adult, 10 milligrams per day, which seems like nothing. I mean, most people, when they're supplementing with zinc, are taking usually about 30 milligrams of zinc. So we know that we're not getting enough from our foods. That's kind of a given, unless people are adhering more to that Mediterranean diet. Then you're definitely going to have more exposure. But I want to be able to draw that connection and understand that when we look at groups that are at risk for zinc inadequacies, we have to include into that people who have GI issues. So people who have gastrointestinal surgery, people who have ulcerative colitis, Crohn's disease. These can create a decrease in zinc absorption. Well, if we're not even getting enough zinc from our foods and we're not supplementing with zinc, plus we've got this chronic inflammation going on, then it leads you to say, okay, that makes a lot of sense why the prevalence of zinc deficiencies is so high. As I mentioned, here in the United States, we can look at maybe about 15% of the U.S. population. However, that number certainly changes once we look at different groups. So when we are looking at groups where we know dietary intake is definitely going to be impacted, we have to be considerate of that. Now, I also want to be able to tie that in to H. pylori. So I hope you're keeping up with me because this is all interconnected. This is the interesting thing. Traditional doctors usually don't like to think about vitamins and minerals. We have pretty much established that fact. Traditional doctors also don't pay attention to H. pylori. And H. pylori is really, really common and really, really problematic. So we know that there are links to the effect of H. pylori when it comes to things like gastroesophageal reflux disease. Now, the big question is, what came first, the H. pylori or the GERD? And my answer usually is the default, well, you're having symptoms that are resemblant of what we know of GERD, gastroesophageal reflux disease, but this is actually brought on because of an H. pylori infection. We know that Helicobacter pylori infection represents one of the most common and prominent infections worldwide. But most doctors are never going to rule that out or even test for that. I've dealt with so many people through the years who have chronic GI issues, the belching and the bloating. And I always ask, have you ever been tested for H. pylori? And they say, no, I have no idea what that is. So I always say you need to go in and ask your primary care doctor to rule that out. Because if it is H. pylori, you need to be properly treated for that. We understand that H. pylori is incredibly prevalent worldwide. And when we break it down by different areas, we look at countries. We can look at Africa, the continent, and say, wow, H. pylori infections are really high there. You have to be able to then also tie in zinc deficiencies in the same areas throughout the world where H. pylori infections are at the highest. We also see the concurrent link to zinc deficiencies. So when we look at different regions, and we can look at places such as Nigeria, for example, where the prevalence of H. pylori infection is upwards of 85%. And then we look at places such as Mexico, for example, estimates of over 50% of the population. We can look in Brazil, Understanding that in Brazil, H. pylori infection, the prevalence rate is over 70%. And then we look in places such as Canada or the US, where they estimate that prevalence rate to be somewhere around 35%. Now, the reason I said 15%, that's for the general population within the US. And then we have different subcategories where we see those levels to be higher. But it's safe to say 35% of the US adult population has that potential of being impacted by H. pylori, which is why we cannot ignore this. And then we have to think, are people being treated for something such as heartburn and GERD when that's not what it is? Is it that we need to make dietary changes? Is it that we need to address the chronic inflammation going on within the GI tract so that we get better absorption of zinc coming from our foods, that we supplement then with zinc so we can obtain adequate amounts to be able to control the potential damaging effects? Remember, I talked about wound healing. If we have H. pylori and that's creating basically a wearing away the lining of that stomach, we are going to require zinc in order to heal that. That's why years ago they used to always think that ulcers, stomach ulcers, were caused because of stress. We now know that not to be the case. We now know that those ulcers, both the duodenal ulcer and the peptic ulcer, are caused because of H. pylori infection. So it's not 100%, but it's like 85% of ulcers are caused because of H. pylori. But yet most people are still not being tested for H. pylori, which is absolutely mind-boggling to me. And this is something that every single doctor should be completely aware of at this point in time. Two professors at the University of Western Australia actually won the Nobel Prize for their findings of H. pylori. They actually discovered this bacteria back in 1982, and in 2005 they were awarded the Nobel Prize because this was such breakthrough, groundbreaking work that they did. And what happened was they kept detecting this bacteria in different stomach biopsies that they were doing. And they saw this really unique correlation between the severity of the inflammation and this bacteria. So it was through that they were able to basically figure H. pylori out. And with that being said, one would think that doctors would be able to correlate this. When we are looking at stomach ulcers and we look at the peptic ulcers, we look at duodenal ulcers, we know that H. pylori causes almost all peptic ulcers, accounting for 80% of stomach ulcers and more than 90% of duodenal ulcers. And this is so common. As I mentioned, it's estimated by some research that 20% of people under the age of 40 in the United States have been infected with H. pylori. And then once we start to get to that more senior age, once we're looking at people over the age of 60, we're looking at probably 50%. So that's why they always say that in the United States, we can pretty much comfortably say that our prevalence rate is about 35%. This is a major, major issue. Now, what the big question always has been is how exactly is H. pylori passed from one person to the next? And they have not been able to exactly pinpoint that. They're trying to determine if this is passed somehow through food or water, or perhaps being that they've been able to detect H. pylori in saliva, they're saying maybe it is actually passed from mouth-to-mouth contact. So things like kissing, for example, or maybe sharing the same drink. So it's still not exactly determined as to the direct transmission of this bacteria, but we do know that it is incredibly problematic as well as incredibly prevalent throughout the world. And it's something that we do not want to mess with. That is for sure. So what I'm going to do, I'm going to take a quick break. When we get back, I'm going to tell you about some nutrients that can be beneficial for the stomach, for the digestive tract, and highlight why it is important, especially if you've in the past had symptoms such as that bloating, such as excessive belching, why you would want to consider taking this particular nutrient that I'm going to be telling you about. So we will be right back.
This podcast is brought to you by InviteHealth.com. For over 20 years, Invite Health has provided premium quality supplements and expert advice you can trust. Now, first-time customers can enjoy an exclusive offer. Visit invitehealth.com/podcast or click the link in this episode description. That's invitehealth.com/podcast for your exclusive offer on Invite Health products. Invite Health offers the resources you need to make important decisions about your health. Chat live with degreed healthcare professionals, get product information, and find retail locations near you at invitehealth.com. You can also learn about our new genetic testing program and our exclusive Invite Fitness Wellness program. Follow Invite Health on Facebook, Twitter, and Instagram, and be sure to subscribe to our podcast today. Now back to our episode.
And welcome back. Now I want to go into some more detail. We know that when it comes to Americans and heartburn, this is a big issue. I mean, you can see it on commercials. All you have to do is flip open a Sunday flyer for your local pharmacy, and they have probably 2 pages that are dedicated to issues with digestive health. So we know that this is a major problem. We also know that proton pump inhibitors, this is a class of drugs. This is one of the most widely prescribed medications in the United States. We know that proton pump inhibitors are the main line, I guess one would say, of treatment when it comes to GERD. So when it comes to acid reflux, heartburn, anything along that lines, PPIs, as they are oftentimes shortened, so that's proton pump inhibitors, they kind of fly off the shelves. It used to be that you need to have a prescription for all of these, but now you can find many of these over the counter, and they have over 14 billion in annual sales. And when it comes to the prescribed PPIs, there are over 100 million prescriptions every single year. Now, interestingly, Stanford University, they did this data mining study, and they found an association between the use of proton pump inhibitors. As I mentioned, there's 100 million prescriptions for proton pump inhibitors in the United States alone, and the likelihood of incurring a heart attack. So I think that this is really important for people to understand this. If you suffer from GI issues and it has gone undiagnosed, or your doctor just says, oh, hey, you have heartburn, or you have acid reflux, here, take this PPI, this proton pump inhibitor, you need to at least rule out that it's not H. pylori, because your proton pump inhibitor is not going to be beneficial. And if anything, could be marching you down a path of an increased risk for a heart attack. So this was Stanford University School of Medicine looking at that correlation. And I think that this is something that many times people don't pay attention to. The proton pump inhibitors, they were first introduced probably about 25 years ago, and they kind of took off, and everyone wanted to be on a proton pump inhibitor. Of course, never was there a discussion about, hey, maybe we need to change your diet, or hey, maybe we need to look and see if H. pylori is causing some of these symptoms. So it is just something that I like people to be aware of, because for all the years that I have been working with folks, I can't tell you how many times I've talked to someone who has been on a proton pump inhibitor for 10, 15, even 20 years. And that can really be a problem long term, because not only for that potential elevation of cardiovascular risk, we also know that there can be a risk when it comes to kidney function, when it comes to bone loss, so greater risk for things like osteoporosis, for example, really can be a major, major issue. So what is it that we can do? Well, we already know that zinc is important. We also know that we need to change our diets, first and foremost, but we have to look at zinc as being our friend when it comes to GI health. It's not just about the immune system. Obviously, we know zinc is wonderful when it comes to the regulation of both the innate and the adaptive immune response. But we have to consider the role that zinc can play when we are looking at inflammation and damage that can occur from gastritis brought on generally from H. pylori. And this is why I like to talk about this particular formulation that we have, which is called Digestive Plus. So our Digestive Plus HX is a blend. It has a registered trademark form of a very unique binded zinc carnosine. So it's zinc bound to the amino acid L-carnosine. And it also contains in it glutamine. So glutamine is also an amino acid and very important when it comes to your little finger-like projections, especially when we're talking about intestinal health. So you have these microvilli. Those are key because they help us when it comes to the absorption of our nutrients. Now, if those are getting beat up, they're getting damaged because of chronic inflammation that can be because of H. pylori, then we have to make sure that we're doing everything in our power to maintain the integrity of not only the stomach, but also of the intestines. So in the Harvard Gazette, they published their findings talking about how glutamine supplementation shows promise in treating stomach ulcers, talking about how this particular amino acid helps to offset the stomach damage caused by H. pylori. So now when you look at the Digestive Plus formulation, you go, okay, it has zinc and carnosine, plus it has glutamine. And this is really very important. So this particular study, which was done at Beth Israel Deaconess Medical Center and the Massachusetts Institute of Technology, they were looking at the amino acid glutamine and seeing how that could be beneficial in offsetting gastric damage caused by H. pylori. And this was published in the Journal of Nutrition. And they said gastric damage develops when the bacteria weakens the stomach's protective mucus coating. It damages the cells and it elicits this robust immune response that is ineffective in ridding the infection. So they talk about glutamine then. They say, okay, well, what can we do? They say, well, glutamine is this amino acid that's naturally occurring in certain foods. But once again, where are some of the great sources of glutamine coming from fruits and vegetables? Well, we know Americans are not doing right by getting your fruits and vegetables, so hence we look at supplementation. And this is one of the areas that these researchers were primarily focused on. They were looking at how the glutamine actually could protect the stomach cells, those gastric cells, from the H. pylori ammonia that is produced. So when we think about different bacteria have their own nasty ways of creating damage. So when we think about H. pylori, we know that this can release its own acid. So if it's releasing this monochloramine, this is what is basically eating away the lining of the stomach. So not a good thing whatsoever. Now, in the Journal of Comparative Studies, and this was also in the Journal of Pharmacological Sciences, they were talking about, once again, prophylactic effect of glutamine against H. pylori, this induced gastric disease. And I think more and more they're starting to say, hey, if we're low in something, we know this happens. Say if you go into a burn unit, for example, we know when the body is under significant stress, then what we can experience is an issue such as lowered glutamine. So if glutamine levels go down because the body's under stress, we're going to have a hard time being able to properly repair. And this is what they recognize is occurring even in the setting of H. pylori. So anytime you're in any type of an intensive care unit or burn unit, you will find that glutamine levels are generally really, really low, which can lead to longer healing times. So we kind of go back to, zinc and vitamin C and glutamine. These are kind of just basics. But unfortunately, very much overlooked. And so that, it really is kind of a shame. Let me tell you about this zinc carnosine though. Zinc carnosine is so unique because we're not just taking zinc by itself or carnosine by itself. It's actually a molecular binding of those two. And it has been studied specifically for looking at GI health. So when we're looking at H. pylori, when we are looking at intestinal inflammation, and they've been able to see that this combination of zinc bound to carnosine does a wonderful job in terms of enhancing the body's ability to repair that gut lumen and helping to stabilize the gut mucosa. Really fabulous clinical research out there that has shown that when they take people who have H. pylori and they do a endoscopy, so they scope them, they go down, they do the biopsy of the lining of the stomach, comes back, shows gastritis, extreme inflammation occurring within the stomach lining, and then they gave them zinc carnosine and then re-scoped them. Even after 2 months, they were seeing this significant shift, lowering in the inflammation and a repairing of those gut cells. This is impressive stuff. But yet, still to this day, you would probably be hard-pressed to find most GI specialists that are even aware of zinc carnosine, even though this research has been out there. We have been well aware of the research on zinc carnosine for a very long time now. And I think this is why I like to talk about this particular formulation, this Digestive Plus, because I know what this registered trademark form of zinc carnosine can actually do for optimizing and healing and repairing the lining of the stomach, as well as being supportive for the intestines as well. And then we add in the benefit of glutamine and knowing the role that glutamine is going to play. Now, there's strong associations between certain disease conditions and H. pylori infections, one of which I want to share with you. I want to tell you about why this is important, why you need to be aware of it, because this could impact you or a family member or someone that you know. I'm going to tell you about this. This is probably the most important thing I'm going to tell you on today's episode, but we're going to take a quick break. When we get back, I'm going to make that connection for you. So stick around. We will be right back.
This podcast is brought to you by InviteHealth.com. For over 20 years, Invite Health has provided premium quality supplements and expert advice you can trust. Now, first-time customers can enjoy an exclusive offer. Visit InviteHealth.com/podcast or click the link in this episode description. That's InviteHealth.com/podcast for your exclusive offer on Invite Health products. Invite Health offers the resources you need to make important decisions about your health. Chat live with degreed healthcare professionals, get product information, and find retail locations near you at invitehealth.com. You can also learn about our new genetic testing program and our exclusive Invite Fitness Wellness program. Follow Invite Health on Facebook, Twitter, and Instagram, and be sure to subscribe to our podcast today. Now back to our episode.
And welcome back. So I was telling you about our Digestive Plus formulation, which is this combination of zinc carnosine. It's a registered trademark form that's been used in clinical research, along with L-glutamine. It's a really unique blend. Now, before I make that connection between this disease state and H. pylori, just want to run through one last study with you, and this was in the PLOS One journal, and it was talking about this combination of the zinc carnosine when it comes to H. pylori associated gastritis. So this was a multi-center randomized clinical trial, and they were looking at the efficacy and the safety. So, hey, if we give people who have H. pylori zinc carnosine, how are they going to do? And it was really quite interesting where they were finding significant improvement was at 7 days after initial start of the treatment, which I think is really to be noted. As I said, when they go back in and they scope people, even after 2 months, they're seeing these major shifts. But they were able to determine in this clinical research that even after 1 week, they were seeing significant improvement of symptoms. So we're talking about even some of the symptoms that people experience when it comes to that bloating, when it comes to the excessive belching. This is something that people just need to be aware of. Okay, so now let me dive into this, because as I mentioned before the break, to me, this is one of the most important bits of research that has been out there. And when we talk about different disease states, most people have heard of Parkinson's disease and really how debilitating Parkinson's disease is. This is a progressive nervous system disorder that affects movement. It causes tremors, can cause stiffness, and can really be detrimental to someone's life. So we're looking at a social aspect of that. We look at the emotional toll that Parkinson's or a diagnosis of Parkinson's can have, what that actually does to someone. And it's not just them. We look at their family members. Then you look at the medications that they put them on, and then those medications over time can start to create some really significant side effects. But I want to talk about a connection between H. pylori and Parkinson's disease. This is huge. This is really huge research. In the Journal of Clinical Neurology back in 2016, they were talking about this association between Parkinson's disease and H. pylori. They go into detail. They talk about Helicobacter pylori being this very common infection of the GI system, and now being able to tie a high prevalence of H. pylori infections in patients with Parkinson's disease. They said that this bacteria causes motor fluctuations by affecting the absorption of levodopa, which is the main drug used to treat Parkinson's patients. And they said that eradicating H. pylori from patients with Parkinson's disease will increase the absorption and decrease these motor fluctuations. So if you have someone who has Parkinson's disease and they have a comorbid condition, they have H. pylori as well, this can be making their Parkinson's symptoms that much worse, which is a horrible, horrible thing. Now, here's an interesting statistic from this. They found that Parkinson's patients, it was upwards of close to 50% of Parkinson's patients had H. pylori infections. They found that the positivity in an H. pylori test was 3 times more common in Parkinson's patients than in any other group. So this is something that I think warrants a really good conversation in the medical world. This is something that, if the underlying issue is H. pylori and maybe not even a Parkinson's issue. So another study came out and they said human genetic mutations are involved in a small number of Parkinson's disease cases. However, the vast majority of Parkinson cases are of unknown environmental causes. So, what is the connection? They said, we don't really know. We know that there's some genetic mutations that might cause Parkinson's, but we basically have an unknown origin of the cause of Parkinson's disease. So they've been able to say, well, it's just environmental risk factors. But now there is this link. There is this direct correlation between H. pylori and Parkinson's disease. So this was actually published in the Journal of Parkinson's Disease, summarizing the literature regarding that link between H. pylori and Parkinson's. Here are the main findings from that. People with Parkinson's disease are 3 times more likely to be infected H. pylori than people without Parkinson's disease. H. pylori infected Parkinson's patients display worse motor functions than those Parkinson's patients who do not have H. pylori. They found that eradication, so actually treating the H. pylori, improved their motor functions. Eradication of H. pylori improved the levodopa absorption. This is absolutely fascinating stuff. Then they said, well, what's the explanation to this? And they said, well, maybe it's these bacterial toxins that are produced by H. pylori that are damaging the neurons in the brain. That the infection itself is triggering this massive inflammatory response that causes damage in the brain. That the H. pylori itself is disrupting the normal gut microbiome. That the bacteria might interfere with the absorption properties of the medication used to treat Parkinson's. So they said screening Parkinson's patients moving forward for the presence of H. pylori is absolutely essential. But I know many people personally who have Parkinson's disease, who have never been talked to about H. pylori or tested for H. pylori, which is why I wanted to bring this to your attention today. Because many people know someone. It may be a distant relative, it may be a coworker, but most people know someone who has been given the diagnosis of Parkinson's disease. And if you walk away with anything, at least encourage them to have an H. pylori test done. And as far as anyone who's out there taking, their antacids on a regular basis, going to their local pharmacy and getting the over-counter PPIs, the proton pump inhibitors, or maybe you get it prescribed by your doctor, have an H. pylori test done. And when we are thinking about what we can be doing to enhance our stomach lining as well as the intestinal lining, to support the healing process and ease the inflammation and regulate the damaging effects that can be brought on by H. pylori, then we want to look at the Digestive Plus, that combination of the zinc carnosine along with glutamine can do so much for your overall health and wellness. So that is all that I have for you for today. Just as a reminder, I want to thank you for tuning in to today's podcast. But remember, you can find all of our episodes for free wherever you listen to podcasts or by visiting invitehealth.com/podcast. Make sure that you subscribe. You can leave us a review. You can follow us on Facebook, Twitter, and Instagram at Invite Health. And we will see you next time for another episode of the Invite Health Podcast.